Yes, we'll wait a few minutes. Good morning, everyone. I think we'll get started. Maybe others will join us. I'm Susan Hay-Patrick, Chair of the City Club Missoula Board of Directors, and I'm delighted to welcome you to today's City Club, where we're going to be discussing the very important topic of mental health services in Missoula. I hope you're all staying safe and physically distanced and socially connected and looking after yourselves and the people in your life. We are recording this meeting. It will be videotaped by Missoula Community Access Television as part of MCAT's Media Assistance Grants to Nonprofit Organizations. MCAT serves the Missoula area on cable channels 189 and 190. You can also find videos of past City Club Missoula forums by clicking the video button on our website, cityclubmissoula.com. City Club's mission is to bring people together to inform and inspire them on issues vital to the community through public forums that encourage the discussion of new ideas and the free exchange of thought. We are committed to doing this in a way that fosters civil discourse and mutual respect, where civically engaged people of goodwill, that's all of you, can gather, learn from each other, and discuss issues with each other, often from very different perspectives. I want to thank our sponsors listed on the slide. A special thank you to our executive level sponsors, Blackfoot, First Security Bank, and the University of Montana. Thanks to all of our sponsors for staying with us. We don't know how much longer we'll be meeting via Zoom. I say that every month. It has the advantage of making our forums more accessible and diversifying our audience, which is a good thing. But the disadvantage is that we're not all in the same room together, and that I think can be especially frustrating when we're discussing mental health issues, because feeling connected is so critical to everyone's good mental health. I want to thank the University of Montana and IT guy extraordinaire, Alex Karklins, for guiding us through every step of our remote forum process. And we appreciate you, our sponsors, and invite everyone on this Zoom to join you in becoming members or sponsors of City Club to support civil discourse around community issues. I also want to thank our board of directors and our administrator, Eric Legvold. By the way, he won't like me saying this, but if you didn't see the great feature about Eric yesterday in the Missoulian's quarterly business section, the Missoula business section, you should definitely pick up a copy. Thank you also to our three panelists, whom our moderator will introduce in a minute. And I want to thank that moderator, my United Way colleague, Rosie Ayers, who coordinates Project Tomorrow Montana, about which you will hear more shortly. Finally, before we begin, sometimes discussing mental health issues can trigger feelings of depression or sadness in vulnerable people. So it's always a good idea at a forum like this to remind everyone that help is always available. If you or someone you know is depressed or suicidal, please reach out to the National Suicide Lifeline, 1-800-273-8255. That's 1-800-273-TALK, or text MT to 741-741, the National Crisis Text Line. You can also find a list of local resources at projecttomorrowmt.org. Click resources on the drop-down menu. It is now my pleasure to introduce Rosie Seitz Ayers, our Project Tomorrow coordinator, who joined United Way staff on April 1st. Rosie has a diverse background. She's a well-known and well-respected local actor and director, and she also has a background in healthcare, special education, and teaching, and was a dedicated Project Tomorrow Montana volunteer before she joined United Way as a staff member. You may have seen Rosie in the one-woman play, Every Brilliant Thing, which shone a light of hope and even laughter on the subject of suicide and depression, and which Rosie toured around the state last summer, performing it here, sponsored by Blackfoot, in Missoula at MCT for 2 nights during Suicide Prevention Week last year. We are so excited to have Rosie on board, especially during a time that is very difficult for so many people who struggle with depression and suicidal thoughts. So take it away, Rosie, and thanks again to all of you for being here.
Thank you, Susan. Welcome, everybody. Great to have you with us today. And I was so overjoyed to be able to be of use and take on this job with a crisis response organization in the middle of a community crisis. Project Tomorrow Montana, this initiative was established to reduce the number of suicides and suicide attempts in Western Montana through collaborative efforts that promote, support, increase awareness, prevention, intervention, and of course, recovery. Under this model, Project Tomorrow has educated hundreds of healthcare professionals, school counselors, community members on how to identify suicide warning signs and safe intervention strategies. Together, we fight for a better tomorrow for Missoula and for Western Montana. So thank you guys all for joining us. Today we have an amazing group of panelists to talk about mental health in our community. We have Levi Anderson, who is the Chief Executive Officer of Western Montana's Mental Health, a role that he assumed in 2018 following nearly 20 years in the medical device and pharmaceutical industries. Levi is certified in healthcare management as a fellow in the American College of Healthcare Executives and has broad leadership experience in diversified healthcare environments. He is a 2-time graduate of the Montana University system, and lucky for him, one of those degrees is in zoological studies, which is currently helping him with his middle school and 2 high school students, who he is so happy to be back in Missoula raising in the last best place. One of our other panelists, Dr. Sarah Potts, is a staff psychologist and director of behavioral health at Partnership Health Center in Missoula. She graduated with her Ph.D. in clinical counseling and psychology from Utah State University. She specializes in behavioral pediatrics in her residency and postdoctoral fellowship at the Boys Town Center for Behavioral Health in Omaha, Nebraska. She is passionate about working with children and families with a variety of emotional and behavioral concerns, medical co-diagnosis, and family challenges. She specializes in parent training support, mindfulness, self-compassion, applied behavioral interventions, acceptance and commitment therapy, and pediatric assessment. She has a particular interest in improving access and quality of behavioral health services in rural and underserved areas through training, outreach, clinical analytics, and telehealth. She is also, of course, niece to the very famous Mrs. Potts from Beauty and the Beast, but no, she cannot get you a meeting with her. I already tried. And of course, our last but not least panelist, Rob Watson. He was named Montana's Superintendent of the Year in 2019. And we are so honored to have him serving as our Superintendent of Missoula County Public Schools currently. Rob has a bachelor's degree in secondary education from Montana State University, a master's degree in educational leadership from the University of Alaska, and received his doctorate degree in educational leadership from the University of Montana. Currently, Rob is a member of the Certification Standards and Practices Advisory Council for the Montana Board of Public Education. Rob also has experience as board member on several local organizations, the Bozeman Public Library Foundation, Bozeman Deaconess Hospital, and Greater Gallatin United Way. Rob believes that providing positive leadership for the local education community is important in creating opportunities to help all students succeed. And rumor has it, although he was Superintendent of the Year last year, he has already been nominated for Best Hair out of all the superintendents this year. So Missoula, let's keep him under stressed so he can keep all those lovely locks. We're hoping for you, Rob. All right. So we're going to start out today. Each one of our panelists will have a few minutes to share a little bit about their organization. And we're going to open it with one of our questions. I could see my child running through the background. Thank you. And so I'll ask them all a question, and we'll take a little bit of time. We'll start with Levi and then go to Dr. Potts and then on to Rob Watson. Our first question that we're going to ask is about self-care. Of course, self-care and connection are so important during this pandemic. What have you been doing to take care of your mental health? And who is someone that you have been connected with during this time? I'm going to turn it over to Levi to start.
Thank you, Rosie. I appreciate it. I also want to thank Susan and City Club Missoula for inviting me to be a part of this session. This conversation is extremely important to our community, so I'm happy to be here and support it. In terms of self-care, I think we all think of self-care as things that help us alleviate stress from our daily lives, whether it's related to recreational activities or otherwise. And like many Missoulians, I find great stress relief in the outdoors. So I've taken many of these sunny days when I have time available to get outside, go on hikes, and spend time with my family. And for me, that's some of the best self-care that I can have. So I appreciate that.
I'd like to say thank you as well, Rosie, and that was a fun intro. I have spent a lot of time trying to have a better balance between life and work, and I think I could spend 60+ hours every week working in some capacity, and I just have felt that it's so important to have that balance and leave my computer and shut my computer down for at least 24 hours on the weekend. I noticed a difference in even my blood pressure, I think, just completely unplugging. I also got a puppy with my partner in the fall, and so we've been training her and doing all sorts of fun stuff on the river. And so that has been my dog and the river have been my main connection of self-care. I also have to say that it doesn't matter how long we take in terms of practicing maybe a quick mindfulness exercise or just a connection to mind and body and self in a moment. Even walking through a hallway, sometimes a 60-second quick exercise, thinking of my feet on the ground, thinking of maybe where I'm carrying any stress or tension in my body. Even something as quick as that can be kind of helpful too.
Rob, would you like to share with us?
Yeah, it's it's a stressful time for all of us. I was just reflecting on an email that I am working on for our teaching staff. And one of the things we always encourage teachers to do in the summertime is take some time for rest and relaxation, because we know that the pace of a school year can get crazy for our staff. And while we all want to do that this summer, what I find is that we have this constant pressure related to the pandemic, and it's really hard, I find, for our staff and for myself to really find that time for rest and relaxation with this constant pressure of the unknown of the pandemic, and it's always around us in our world. So I know that's difficult to say that and to believe that in this summer, but we've been talking to our staff about taking rest and relaxation. The thing that I have tried to do is remain positive. And that's very difficult on some days, as we can all imagine. But I try to start my day with a positive attitude every day. It's something that my parents told me a long time ago, is you really can't control what other people do, but you can always control the attitude that you show up with. And that's what I try to do, is remain positive. I also find that giving gratitude is really helpful in that. And I try to make sure I do that on a daily basis, because when you give gratitude, it not only helps the person that you're talking to, but it also helps you as an individual, because you're giving gratitude, which makes you feel good. So I try to do a little bit of that every single day.
We're excited to hear a little bit more about your each individual organization and recent experience. So our next question, and then feel free to talk a little bit more about your organization at the end of this question, and we'll go in the same order, is how has your organization adapted during the pandemic? What have been the biggest challenges for you and the most positive changes? Levi?
Great. Thank you, Rosie. And I think I'll take this opportunity to initiate my screen share and my slideshow, because I will address some of those things throughout this presentation. Had a few quick slides to share with everybody today. As is the case with most nonprofit healthcare organizations, excuse me just for a sec. Everything we do at Western Montana Mental Health Center starts with our mission. We build thriving communities through compassionate, whole person, expert care. And we fulfill that mission by providing comprehensive behavioral health services from more than 50 sites through 17 counties in Montana. So we have a fairly significant area in which we operate. And for those who are not familiar with Montana geography, when I'm talking to folks from other areas, I always like to put the geography in which we operate in the context of the state of Pennsylvania, because the square mileage that we cover is roughly equivalent. As I mentioned, comprehensive behavioral health services refers to a continuum of care that is designed to meet the needs of individuals across a broad spectrum of need, and really meet those individual clients where they are and provide the right care at the right time in the right place. So as you can see on this slide, I've tried to share a few of the programs that we operate throughout our geography. And some of those programs are very well known, like here in Missoula. The flagship program is a program of the Western Montana Mental Health Center, and one that we operate in collaboration with MCPS and other school districts in this area. Some of our other well-known programs would include Recovery Center, which is our inpatient substance use treatment facility. But then beyond that, we also operate a variety of other lesser known services. Those services may involve assertive community treatment, or a way for our staff to proactively engage clients in community and be present in community to provide services. Or on the other hand, some of our crisis intervention services, and having teams available both in community and in our stabilization facilities scattered throughout the region to support individuals who are experiencing mental health emergency. I wanted to start by ensuring that there was an understanding of the programming that we operate, because I felt it was important to understand all of those different programs as it relates to the impact of COVID-19 on our operations. So the next three slides really address the immediate impact of COVID on our agency and on our operations, the lessons that we took away from that first 6 weeks, and then really what we're projecting and what we're looking at towards the future as we continue to navigate COVID-19 through an unknown period of time moving forward. I think the first day that we really understood or began to understand the incredible impact that COVID-19 would have on our operations was ironically St. Patrick's Day. The day before St. Patrick's Day, we were addressing an event that we have scheduled in Butte. And I'm sure many of you are aware that St. Patrick's Day in Butte is a very special time. We have an annual event where we host over 100 clients and staff members at our facility in Butte for a lunch. And we understood at that time that that event was not going to be possible. All the recommendations at that point from the CDC were to limit gathering sizes, and we knew that we would have to not only cancel that particular event, but really rethink how we dealt with a number of different services that we provide. So that led us, unfortunately, to have to suspend a number of different programs that are built around the idea of group involvement and large group sizes. Beyond that, we also operate a number of different group homes for severely disabled mental clients experiencing severe disabling mental illness. And so while many of us were struggling with a stay-at-home order and trying to social distance, that really puts in a new context the impact on individuals who are living in a group home environment. So those individuals and those environments were ones in which we had to deal with very specifically to try to keep them engaged with their normal activities, but also abide by the stay-at-home order and make sure that we were limiting risk for disease transmission for those individuals. And then beyond that, we operate 24/7 crisis facilities, crisis stabilization facilities in a number of our communities. So really it was an idea of trying to understand how we could still have individuals enter that care, enter that facility, and make sure that we were mitigating risk as best we could. There's been a lot of discussion around personal protective equipment. We are a behavioral health agency, but we are not a standard hospital-based healthcare group that may have access to personal protective equipment. So even the acquisition of PPE was a new thing for our organization, especially in the volumes that required for us to continue operating adequately. So that alone took several weeks. And then in addition to that, we had to create a variety of policy and procedure to ensure that our staff had proper guidance to use that PPE. And then of course, we had to transition to telehealth. By the third week of March, we had approximately 80% of our staff working remotely. So we had to ensure that we had the technology available to them and to our clients to be able to provide our services effectively. So what did we learn from that first 6 weeks? I think first and foremost, we learned that maintaining engagement with our clients and providing care appropriately takes more than just technology. There were a number of gaps that we had, and we really had to be creative and work collaboratively with different partners to address some of those challenges. We're fortunate to have partners like Blackfoot, who is sponsoring this event today, to help us provide broadband to areas in which some of our clients did not have that access. So for us to be able to use telehealth, we actually had to intervene and provide that service for some folks. And then some of the services that we had to suspend involve social interactions and involve engagement, personal connections that we really had to try to replicate for the care environment to be as close to normal as possible. That's been a significant challenge for us. But it's as much as we focus on our clients, it was also a struggle for our staff. So staffing during this time has been a significant challenge, and we've learned that staffing these types of services requires a lot of flexibility on everyone's part. We had to understand that there were individual fears that were being faced for someone to come into the office or come into a clinical environment where they're providing care. We had to acknowledge those fears. And at the same time, on the business side of our agency, the vast majority of our folks were not reporting to a regular workspace. So we had to devise ways to maintain accountability through that remote work environment. And finally, as a community service provider, it became critically important for us to communicate and communicate and communicate again. We reached out to a number of different partners and established ongoing communications and meetings, and really trying to do the best we can to have some awareness of the services that we have available for all those in our community. And then finally, as we look towards the future, some things that we're learning and some things that we're projecting. Number one, we've always used telehealth, but this crisis, this last 4 months, has allowed us to use telehealth in a brand new, expanded way. So telehealth is here to stay. I think for us to be most effective in this care environment, we'll have to work with our legislators to make some changes on how we can improve access for rural communities. It's been critically important for us to have flexibility in the use of telehealth and the use of telephones to provide clinical interventions. And that's something that we see as being very beneficial moving forward. Those technologies also allow us to leverage our clinical staff across the entire geography that we cover. So now our clinicians who are here in Missoula can not only help our neighbors within Missoula City and within Missoula County, but also reach out to other areas like Mineral County and Lake County and Ravalli County, where there may be needs as well. I can tell you the last 4 months, we've put a tremendous amount of work in our disaster preparedness plans. This is something that historically our agency has not had readily available or formalized in any significant way. So now our emergency response plans are much more robust. We've had to improve our supply chains so that we have access to PPE and other things needed to ensure our services are up and running. And then finally, we were able to implement surveillance testing and screening processes so that we're eliminating risk or limiting risk of disease transmission as best we can. And that's critically important to us. But unfortunately, I think many of us are seeing, and this is becoming a national conversation, that our agency is preparing for an increased need of mental health services. We are seeing a huge increase in the acuity of cases that we're treating in crisis, as well as the acuity of cases that we're treating in substance use over the last several weeks. We anticipate that unfortunately this may continue as social isolation and social distancing continue to be a major part of our lives. We're starting to see stresses throughout our communities that we're trying to prepare for. And that's one of the reasons why Western Montana Mental Health Center opened our behavioral health urgent care clinics throughout a number of different areas, Missoula being one of them. We're committed to providing same-day access to mental health services so that hopefully we can intervene upstream and in advance of anyone truly experiencing a mental health emergency. Of course, we have crisis services, but it's in everyone's best interest if we can intervene at an earlier time and do some prevention work with those individuals. So thank you for your time, and I'll stop my screen share.
Thank you, Levi. Being on the committee for the Mental and Behavioral Health Task Force with COAD, I was really impressed to watch how quickly the behavioral and mental health urgent care that you guys created was up and running after the pandemic started. It was really amazing to watch all your employees come together with the whole community and be a part of that. So thank you again. And could you just touch really quickly again on the expansion of your crisis line and what has happened in COVID during that?
Yeah, I appreciate the opportunity to do that, but we've always operated crisis intervention services, meaning we have teams available to perform mental health evaluations for individuals experiencing mental health emergencies and perform those assessments in a way that we can understand what level of care is needed, if they need to be admitted into a behavioral health unit, if those individuals might need to be involved in our community-based crisis stabilization facilities, or perhaps even be referred to the Montana State Hospital. But I think across the entire state, certainly throughout our region right now, we've identified a need to bring more specific resources to crisis services, and that's something that we're really trying to build and add new types of services there. But recently, throughout the COVID crisis, and especially during the stay-at-home order, we started to see a significant increase in case acuity. And many individuals who previously might have been seeking a therapeutic intervention well before experiencing that emergency are now waiting because they're isolating. They're reluctant to go into a care environment. We're seeing more people hit that point of mental health emergency, and our resources are starting to become taxed as a result of that. We're seeing a huge increase in that need, so we're trying to address it.
Great. Thank you so much. And if you wouldn't mind putting in the chat that crisis line for your organization, just so everybody can see it. Thank you so much, Levi. Dr. Potts, same question to you. How has your organization adapted during the pandemic? What has been the biggest challenge for you and the most positive change? And then feel free to share your screen and a little more information with us.
Okay, thank you. Yeah, I'll go ahead and share my screen here. A lot of what I put in the slideshow. Sorry about that. Yeah, a lot of what I wrote about in my slides also. I think just speaking to how creative we've been, like Levi mentioned, you mentioning a lot of creativity that was needed. I feel the same way within our organization too. So I feel like we've adjusted together quite well as an organization. I'm gonna have to use this too. So just to give you a background, we are a federally qualified health center in the Missoula County. We have 7 sites throughout the county. And if anyone's listening who isn't super familiar with what an FQHC, what a federally qualified health center is, well, we've been around since the 60s. And our centers like ours, health centers, community centers like ours, were created kind of in an effort to work toward healthcare equality. So same kind of time frame as Medicare, Medicaid. We were born in 1989, and so now just 31 years later, we serve over 16,000 patients, and patients of all ages. In practice, I am a child psychologist. We have family medicine. We have a pediatrician, so we serve across the lifespan. We also have an academic training site, which I was really excited to partner with when coming here too. We have the Family Medicine Residency of Western Montana. This residency is committed to developing family physicians who are compassionate, clinically competent, and motivated to serve patients and communities in the rural and underserved areas of Montana. So together, and I have to mention both pieces, we're a pretty awesome duo, if you ask me. And I've been proud to be here for just about 8 months now. I feel like I got on board just in time for some excitement and a lot of change. So we have been creative in how we deliver healthcare. We absolutely had to transfer to telehealth. So I would say that's the biggest piece is we had fewer than 50 telehealth appointments. And now we have, as of May 31st, we have a lot more appointments now. But in our first telehealth survey, we had 6,538 appointments. So we transitioned that way. To me, it feels like overnight. And it really kind of was overnight. And I was thinking of St. Patty's Day weekend as well. I was in Whitefish for a conference. I feel like I came back to work on Monday, March 16th, feeling like this is going to be a lot different. This is so different than anything I think I've ever experienced. I think it's true. So as far as other things, we've definitely put our minds together, training and supporting staff, making sure that people feel confident to deliver services over telehealth. With that, even making sure patients know how to access telehealth. And we've actually trained, kind of had brief training sessions for any patient who hasn't accessed our services over telehealth. So we do a brief visit with one of our patient service specialists just to make sure their Zoom is working, just to make sure we can see them, they can hear us, that kind of thing is working. And we had some really good feedback about that from our first telehealth survey that we sent out to our patients. There's a lot of change. I feel like we've been pretty creative together, and something that also helped us work so well together so quickly was using an incident command model. So an ICS, incident command structure model. I had never worked in this model before. One of my colleagues, our director of operations, Abby Barrow, had said during that weekend, everyone needs to learn what ICS is. When we come back, let's operate in this framework. So we had an operations team, a planning team, admin, finance team, and logistics. And Lori Francis, our CEO, actually operated kind of as in a team with a couple of individuals as the incident commander. This allowed us to operate in our own lanes. And so I feel like we got to attack so much at once because we were so organized in terms of what lanes we're swimming in, whose responsibility is what. We were still able to pilot new formats while also tending to patient care. I'm proud of all the work we've done, and I feel closer with so many of my colleagues. I feel like I got to know people so quickly over the last few months, and being a new member of Partnership Health Center, I feel like there's no better way to get to know people except being under a lot of stress for a while. I mentioned a couple of these policies. I don't have to go into detail with it now, but I do have to mention that we're able to do telehealth in all the ways that Levi mentioned as well because of the opportunities afforded to us right now. So we can see people in the same neighborhood, and that wouldn't have been possible before. So with our HIPAA waiver, our Montana Medicaid allowances, and also our expansions before I ever moved to Montana in 2015, and even with our CARES Act, we can deliver telehealth in such more flexibility. Right now, we can deliver telehealth over phone. We can deliver telehealth over a video format. That might not always be the case. We're hoping it could be because a lot of people benefit from the phone option. But we definitely want telehealth to be an option moving forward. So I will pause there. I don't know if there's a spot. I might share my slides again later, but we are passionate about providing a service that feels both good for patients and also feels like we're making a difference on the staff side too. We have dedicated providers here who care about people in our community, and we've definitely worked together a lot.
Thank you, Dr. Potts. We're so grateful to have you on that team, and it's just been wonderful to have you a part of Partnership and our community in general. We're so glad that you moved back and became a part of our community. And I had mentioned before our COAD task force, the mental behavioral task force that I personally worked on and is still in existence. COAD stands for the Community Organizations Active in Disasters, and we have representatives from all over our area that come together to really attend to the best needs in our community with the best practices. So thank you so much for that. We're gonna turn it over to Rob. Same question. Mr. Watson, how has your organization adapted during the pandemic? What has been the biggest challenge for you and the most positive changes?
Great questions. I would start by saying that what I've really appreciated about being a newcomer to Missoula has been the coordination with local leaders, and feel really privileged to be a part of some of those discussions and some of those acronyms that were just mentioned. I thought we had a lot of acronyms in education, but there's even more so in incident command structure. So I have appreciated it. What I've really appreciated is the opportunity to bounce ideas off of or share things with our community leaders. I think that when we're all coordinated, it really does work better. While we may not always agree with each other, I think the coordination has been really, really helpful. So as a new leader in the community, I've just really appreciated that opportunity. It's been very interesting for us, the entire experience, and I just wanted to share a couple of highlights and then also talk a little bit about what we learned from the process, which I think will answer the question. So if I can advance my screen here. Hopefully you'll see a picture of a bus. And what I wanted to do is talk just a little bit about what we learned in remote learning. So just like everyone else, we went to a remote learning or a teleschool option in the middle of our spring break. So that middle of March was our spring break, and we went into a school closure mode as ordered by the governor. So what I wanted to do is just share some facts and figures that happened during that time. So we gave out or handed out for students to borrow about 1,500 devices, computers that were needed by families to get access to the remote learning. In addition, we found a fairly large part of our population that needed internet access. So we were able to secure some hotspots to provide that internet access for families. About 125 were given out. And I know that's not a huge chunk of our population, but it was definitely needed by those kids and families to get access to the remote learning. We quickly transitioned with Beach Transportation's help. We transitioned to a lunch delivery model. And what was really great about this model is we actually delivered to the neighborhoods. So we went to the bus stops. So where a kid would normally come to pick up the bus, they could come in the middle of the day to pick up a lunch and breakfast for the next day. And I will tell you that was accessed by many, many families. It was free for all kids. Didn't matter if they were Missoula County Public Schools kids or not. Any kid under the age of 18 had access to that. Because of a grant through the federal lunch program, we were able to give access to any kid that needed it. And we had families come and get that throughout the entire closure, 57 days of lunch and breakfast. In that time, we served over 92,000 bags of food, and those bags included the lunch for the day and breakfast for the next day. So I really am internally grateful for Beach Transportation for helping us get that done. I would tell you also our food service staff and the staff that were on the buses were volunteer staff. We sent the word out, and we quickly had people that wanted to do that work. And we had staff that were committed to all 57 days of getting those lunches out. So really appreciate that help from those folks. We could have never got it done without them. What we learned. So we're still learning about what happened in remote learning. And I want to just reference a couple of national pieces of data that I've been reading about. Now, obviously, our students were in remote learning, and so we haven't really had a chance to meet with them again to assess what they learned and what they didn't learn in remote learning. But there have been some national studies on this, and I want to talk briefly about the learning loss that did occur, not just here in Missoula, but across the nation. So what you'll all recognize and probably already know is that we already experienced a little bit of learning loss over the summer months. So there's been a lot of national research on summer learning loss, and typically students lose about a month's worth of learning during the summertime. So the way that we measure that is when a student comes back in the fall, we can actually measure how many days it will take for them to get caught up to where they were in the spring. And usually, depending on the student, it's anywhere from 30 days to 45 days. That's the summer learning loss. What we're hearing and what they're predicting for the COVID remote learning shutdown is 3 months worth of loss for reading and 5 months worth of loss for math. And that again depends on the grade level and the age of the student. But generally speaking, as students are just starting out in kindergarten, first and second grade, they're just learning how to read. If they don't have that continual practice in reading, then that's where the learning loss can be even worse. So we know that there will be some learning loss. And then the last thing that really makes this COVID experience kind of unique is that the decline will be at different rates. And the reason is because some students had better access or engaged more in the remote learning versus other students. And so we know that when the students come back, there will be a vastly different population in terms of ability level at different rates. So that's one thing that we have learned from remote learning and the learning loss. And these are the way they determine these national studies is they looked specifically at previous cases of learning loss. Like, for example, when Hurricane Katrina happened, there was a significant amount of learning loss in that part of the country as students couldn't go back to school. So that's how they've done some of these predictability models. And this is what they expect when students come back at the national level. And then the other thing, which is very relevant to our discussion today, is we know that this remote learning and the pandemic has had impacts on students' mental health. They're predicting for 3 reasons. We're in the middle of a public health crisis, which is a traumatic event. Our students experience social isolation during the closure. And then obviously, possibly an economic recession, which also can have impacts on students' mental health. What I wanted to point out, though, which I found very, very interesting, is if you look across the country nationally, if you look at all the students nationally that receive mental health services, 57% of the students that do receive mental health services receive them at the school in some form. So our schools are offering quite a bit of mental health services for students. And I just want to recognize that when we went into remote learning, obviously some of that continued through telehealth, but a lot of it students didn't have access to. We also did 2 surveys, and I just want to talk briefly because I think this speaks to the stress that's out there in our community. We did a survey of our parents in the first 2 weeks of June. We had enough respond to the survey that we feel like it's a pretty good representative sample of our parents. And I'm just going to go through a couple of highlights. 38% said that they were satisfied or very satisfied with remote learning. So that's a big chunk that obviously we're not. 46% had reported high levels of stress with remote learning. Obviously, all of us, when we are trying to work, but also have kids at home, definitely is very stressful. 45% said that they have health and safety concerns with the return in the fall. But on the flip side of that, 60% are confident that we'll be able to develop a plan for a healthy and safe return. And then 68% agree that they do plan to send their kids back to school in August. And I know 68% sounds a little bit low, but about 25% of them said they were neutral at the time of the survey. So I think that those 25% are really kind of waiting to see what things look like in August. But we have I believe a high percentage of parents that do plan to send their students back in August. And then we also surveyed our teachers and our classified staff during that first 2 weeks of June. And here's some of the stress related that we pulled out of that survey. 59% worry about the impact of COVID on their personal health. 53% expressed a high level of anxiety. 45% were confident in a safe and healthy return, but again, a big percentage were neutral to that question. And then 66% were confident that they could return in the fall. I want to talk also about what we learned and how it's kind of guiding our planning for the fall. Here is 3 things I know that we're going to be working on, what we could do as educators when kids come back. We want to focus on relationships first. I did mention this once during the remote learning that we are living through a traumatic event, and we know that trauma has impacts on not only on our work life, but it also has impacts on how students learn. We understand that better now than we ever have before, just about the impacts of trauma and trauma events. So we understand that when kids come back, they will be still living through some of that trauma, and it is going to impact their learning, not just for some kids, but for a large percentage of kids. So obviously that means focusing on relationships and frequent check-ins with students based on what we're seeing. We also know that kids are going to come back at different spots in terms of their education. And so what we really have to do that first several weeks of school is strengthen the diagnostic checks. That means more frequent checks for understanding of our students, making sure that we're checking to see how they're progressing and if they need extra support. And then that'll also help us determine how much time we need to spend reviewing some material that they may have missed last spring. And then the last piece of their differentiated instruction is something that we've already done for a lot of years, but we need to do even more of it. And that basically means as a teacher, I know that kids are coming in at different levels, and I sort of have to meet kids where they're at and carry them forward from that point. So that's differentiated instruction is not easy, but it's something that our teachers have some experience with already. And then the last thing I'll just point out is we obviously have a lot of questions about what fall looks like. It seems to change every day, if not every week, in terms of some of the guidance that we're receiving. The first week of July, we received guidance from the governor's office and from the Office of Public Instruction. The guidance was somewhat similar and somewhat different in terms of what we should be doing in the fall. Both of those pieces of guidance were based on guidance from the CDC. We also received some guidance from the American Academy of Pediatrics, which is just another source of information. I appreciated the guidance that we received from the American Academy of Pediatrics because it was more specific with regards to certain things that we should be thinking about. But we're using all of that guidance to really plan for the fall. We haven't released anything formal yet, but we are starting to create some documents that will give folks an idea of what it might look like. But what I have learned is that we have to be very flexible, and we're going to have to plan for multiple scenarios as the case counts go up or the case counts go down, or guidance or direction that we get from the local county health department, we're really going to have to be flexible. We are planning, this is new for us, we're planning a ramp-up program for a select number of students, and these are students that we identified as students that really struggled in the spring, and we've invited those kids to come back a few weeks early, and we're going to start that in August. And I think this will be really great because it'll help us define what the fall will look like and help us determine what works and what doesn't work with kids. So we're planning that at every single school, elementary and middle school, ramp-up program that includes our staff and some other key folks in the building. Pretty small programs, probably less than 8 to 10 kids per teacher. And it's just a 2-week trial basis for that ramp-up. We're putting a lot of health protocols in place, as you can imagine. We're complying with the mask order that came out last week. We've already been doing that with some of our summer programs in place. And then we also are looking at other precautions. The CDC and the governor and the state Office of Public Instruction have really encouraged us to limit sizes of groups, but also limit the mixing of groups. So we're trying to look at both of those scenarios. I think we can bring students back in a full capacity, but we may have to limit the mixing of groups, which is easier at elementary and it's a little harder at middle school and high school. And then we're also limiting the visitors into the school. What we're hearing is that the transmission between adults seems to be a lot more prevalent than the transmission between kids. So we want to limit the adult visitors in the schools during this first phase. If there is a confirmed case in school, we expect there will be a short-term closure, could be 2 to 5 days, to allow for the health department to do some contact tracing. We will offer a remote learning option for any of those students who cannot attend. We know that that's important, that they still have options for education, so we're working on that as well. And then the last thing I already mentioned, we know we're going to have to be very flexible and adaptable because things will look a lot different in the fall. So to be specific, I mean, I think we're still waiting for guidance from the Missoula County Health Department, but what we're hoping for is everyday instruction for every student. But we are really looking at the schedule. It may be a shortened schedule in some situations, or we may alter the rotation of the schedule. So at middle school and high school, you know that our students rotate between classes, and we may limit that so students are only mixing with a couple of different groups per day, just in order to get the mixing of groups down. We can't social distance in a lot of our classrooms. Our classrooms are just not big enough to socially distance. So what we're probably going to end up doing is focusing on other risk mitigation strategies, like the use of masks in the classroom so that we're limiting the transmission. And then, as I mentioned before, just limiting the mixing of groups. We know that recess is going to look different. Lunchtime is going to look different. After school activities are going to look different. We just don't know exactly what those will look like yet, as we're still working through some of those plans and waiting for guidance from the health department, and also sort of watching to see what happens with the spread of the community spread of COVID. So I think that answers most of it. I'm going to stop there.
Absolutely. And we all know that during this time of civil unrest and the COVID, we often have more questions right now than we do have answers, but we are united in finding creative solutions. I'm going to pass it back to Susan Haypatrick to say a few more words and introduce our question and answer section.
Thanks, everybody. Really very, very interesting, thought-provoking conversation, and we really appreciate it. Those of you who are regulars at City Club know that Q&A is a very rich part of every City Club forum. So please use the Q&A function, not the chat, the Q&A, to type in your questions. I encourage you to not be anonymous, but to have the courage of your convictions. 2 of our board members will forward them to Rosie to pose to our panel. It's often unlikely that all questions can be answered due to time limitations, but we will, we'll do the best that we can to get through them. We are looking for questions, not position statements, but succinct civil questions. And if you're here representing the media, please wait to ask your questions until after the forum. We're happy to connect you with our panelists. So I think that Brett and Peggy, are two of our City Club board members, have been taking a look at the questions and sending them on to Rosie. So let the Q&A begin.
Excellent. Thank you, Susan. Yeah, we've already had quite a few questions, so I'm going to try to condense a few of them that are similar and make sure that we give everybody an opportunity to share, and I'll continue to look at those questions as they come in. So thank you guys for continuing to respond with your questions. One of the several of the questions that we've gotten already are about the trauma impact of this pandemic as it relates to people's ability to learn and even perform tasks within your organizations. So what we want to know is, how are you preparing for the mental health consequences of the projected effects of COVID-19, both on your clients, your students, and your employees in your organization? Is there anything that you're doing to encourage, you know, mental health, and how does that trauma, how do you anticipate the trauma affecting people in your organizations? And who would like to start? That's a question for all of our panelists.
I can start with that.
Thank you, Sarah.
So I think this whole time have wanted to have as much consistency and room for building reliable expectations for our staff, and also maintaining all of our services as much as we would, although they are over telehealth. So we're maintaining all of our groups. They are meeting over telehealth. We're adding more group options for youth and for adults. As far as our staff, we're wanting to have as much choice as we can. So we can't choose a lot of what's happening right now, but if we have a little bit more room for making choices of how we work, where we work, if we identify in a high risk category, are we going to be safe working in the workspace? Those are all considerations that we're encouraging all supervisors and staff to talk about. We do have a system right now for anybody who may identify in a high risk category. We're trying to keep as many people working as typically as they would. And so I feel like there's a lot of flexibility, and we're being very creative in terms of having people work in maybe different capacities. Maybe somebody who identifies as in a high risk category, they may not be in the same patient facing role as they may have been before, but because of our opportunities in telehealth, we also have different roles and different areas that need support that we didn't before. So we're trying to maintain as much consistency, and also trying to get back to a more structure that people can rely on in the work setting.
You were muted,
Levi,
Rosie, but I got it. Yeah, so very, very similar to what Sarah was saying. I think from my perspective, operationally, it's perhaps easier to understand how we can enhance access for clients and individuals who may need services, behavioral health services or mental health services. So we put a lot of effort into identifying ways and operationalizing ways to improve access to our services. I think our commitment to same-day access really captures that effort. You know, we want to make sure that we're providing care when it's needed, rather than looking at trying to schedule an appointment for 2 weeks from now. You know, that's not effective for somebody who identifies that they need assistance today. So our commitment to that same-day access has been really important. But I am willing to admit that it is frequently challenging from the staff side, looking at how we can help our staff understand what their work-life balance needs to be. How do they self-identify in the idea that they're experiencing an undue level of stress or a heightened level of stress? And then beyond the identification, how do we encourage them to seek some stress relief and some self-care options? So those are things that we work on every day. I think communication is a big part of that. And I mentioned that in my slideshow, the idea of sending emails to our staff, checking with our staff, having our leadership group check in with staff on a regular basis and provide different resources, whether it's through the CDC website. The Montana Department of Health and Human Services has a great website with a lot of different options for self-care and stress relief. So we try to encourage the use of those resources as best we can.
Thank you, Levi. And Rob, a little specific about that particular question for you. One of our attendees noticed that you had mentioned about taking respite over the summer and encouraging your teachers to do so as well. Is there anything they wondered that you are doing to make respite more accessible to your staff? And, you know, whether it's providing pay increases or lobbying the state or government for funding to support the students, and how are you reimagining what supporting mental health with students and your employees looks like over this next coming year? Big question.
Yeah, that is an excellent question. I would tell you that mental health services for our staff is something that we were actually looking at pre-COVID. This last year was our first year in our district that we launched an employee assistance program that provides free counseling. I think it's up to 3 to 5 sessions of free counseling for any staff member. And that was all pre-COVID. That's something that we found was very useful this last year. It's anonymous, it's confidential. Our staff is accessing it. So that's something we will continue. As far as our students, I think one of the things that made me most nervous in the remote learning part of our environment was we didn't have that opportunity for frequent check-ins. It's so much easier to check in with a student when they're in your classroom every day or every other day. So that was really scary for us. We did the best we could to check in with as many kids as we could, but quite honestly, I know that there were some kids that fell through the cracks, not just academically, but also for their just mental health support and social isolation. So that's something that we will have to do a better job with this fall. If we are in a remote learning situation, we'll have to figure out ways to develop that system so that we don't have any kids that fall through the cracks.
Thank you, Rob. And I have been a Spark theater teaching artist with the district for quite a few years now, and I was quite impressed that not only was Spark offering videos about social emotional learning and isolation, and those videos are still up, they were offering interactions individually with kids. Artists around the community were really pooling to try to find creative ways to support teachers as well. They were doing mindfulness activities and groups with teachers, especially in the beginning of COVID, to help them to be able to focus and put their own oxygen mask on first to be able to help the kids. So there's a lot of creative solutions out there. And our next question comes from, let me just move my screen here, from William Lawrence. He says, I work with an organization whose members are seniors who live independently and some are shut in with limited technology support. What services are available to a senior who is shut in or who just needs someone to talk to?
I'd be happy to talk about that too. So I hope, William, that you don't already work with Missoula Aging Services, and maybe you do. But in the instance that you don't, Missoula Aging Services is here in Missoula, and they have a plethora of support services for seniors around Missoula, actually in the whole county. We've actually partnered with Missoula Aging to serve outside of the city of Missoula. We have a lot of patients who live in the Sealy area. They have a lot of neat programs, but one neat program they have is Meals on Wheels. And this is an opportunity for individuals who may not have the accessibility to get outside the house to go get groceries, or even connect with others to be able to get those services met, where food is actually brought to their location. So I can send a response here to Rosie, and you can share that if you like. I have their website, and I encourage anyone to get on their website and look at all the other opportunities they offer.
Next question. We've had several about the social connection being a major element as far as our mental health goes, and our social connection, how it's been curtailed or altered in a multitude of ways. And how can people, especially students and children, and those identifying as LGBTQ plus still find connection and interaction with their peer groups during this time?
I'll start. I'm sure others have some comments as well, but I think, that has been a challenge that we've identified. Rob mentioned it, but just the idea of maintaining engagement, especially in youth populations, and how to get them connected to friends and ensure that they have an outlet and an ability to maintain those connections. And I think some of our services that are focused on youth and adolescents, again, the creativity seems to be a common theme, but really we've been working to engage them in smaller groups, trying to maintain social distancing, typically in outdoor environments, providing masks and PPE to ensure that we're doing the best we can to limit exposure or risk of transmission. But I think there are ways to do that, especially in an outdoor environment, to be connected, and as simple as taking a couple kids and going on a walk and having conversations and trying to engage and allow them to have some type of therapeutic interaction. As far as kids that are not part of our programming, I think parents could also take the same approach. And I speak from my own personal experience with trying to have my kids maintain their personal connections with friends and how to do that appropriately and safely. So I do think that there are ways to encourage that. Typically, I've found the most success in outdoor environments.
Are there any other platforms or strategies that we can talk about in helping children to connect with their peer group, and particularly LGBTQ plus students? The first one that had come to mind for me was that Project Tomorrow always works with the Trevor Project nationally, and Tamarack Grief Resource Center here in town has been creating a lot of new platforms and groups and looking into those connections. They work with the Missoula County Public Schools and the counselors in those offices as well to provide new and interesting services, as well as many of, we were talking a little bit about the arts organizations in town. But we do know that face-to-face contact or one-on-one, even on Zoom, is much more useful than just passively getting videos as well. Sarah, you had perhaps a response to some of that?
I love the Trevor Project, and I actually wrote that in a little blurb here to send to you. I'll just send to you here, and you can share it with anybody if they're interested. I do recommend checking that out. I wish we had a group for teenagers here at Partnership, and we don't have that. I have a lot of to-do items on my list. I've only been here 8 months, but I think that'd be a great resource in the community. It might be really neat to partner with schools too, Rob, so maybe we should talk about that. But I also like to think that just because we're socially distancing doesn't mean we're in isolation. So like you mentioned, Rosie, using screens, getting involved, hanging out with people in ways that are safe, it's so important to get out there and do that in whatever way is safe and available. But just because we're social distancing doesn't mean we're in isolation.
Rosie, you're going to have to unmute.
Thank you very much. All right. And another question, a follow-up to the survey, Rob, that you provided some answers for. That survey, one of the attendees asked that this survey was sent out prior to recent resurgence of COVID in Missoula. Does MCPS have a plan on resurveying families and teachers?
We do, yep. So I mentioned a couple of different times in that survey where we got a lot of neutral, and that's completely understandable. That survey went out, right at the beginning of summer, and we still had a lot of unknowns, and there will continue to be unknowns. So the other thing I think people were kind of waiting for is to see what exactly our plan might look like for the reopening. We have a couple now more firmed up scenarios of what that might look like for the reopening. And so once we get those out to the general public and they have a chance to ask questions about those, we'll send a follow-up survey for both staff and parents.
Thank you, Rob. Faith Price asked, on top of the stress and trauma of COVID, systematic racism has come to the forefront as contributing to disparities in the pandemic, overall health, education, justice system, etc. How is your organization addressing systematic racism currently?
I can speak to that. We already have at the forefront of our mission as an organization that we honor and respect all people, and that all people are welcome at our health center. Internally, we are doing more cross-cultural, multicultural training for all staff. And these are also initiatives that were already on our radar, and I think should be on our radar for forever.
I would just echo that we also had and continue to have a fairly robust non-discrimination policy in our school district policy. It's based on the fact that all students, doesn't matter what your background is, all students have an opportunity and equal access to high quality education. And that's something that we, again, recommitted ourselves and reminded our board of trustees about that policy and our staff recently. But really the question, I think, really gets to the systematic piece of that. And what I'm convinced is that there is systematic racism. And I'm also committed to figuring out what we can do to change that in our own organization. Now, what I will tell you is that the more that I listen to students, the more I learn. And I'm committed to listening to students on this issue. Because quite frankly, I believe I understand what some of the issues are, but I have not experienced our system through the eyes of our students. And I don't believe I can really fully understand what it is until I talk to them. So that's something that I'm committed to do this fall is take time and an opportunity in an organized fashion to really hear from our students regarding that issue of systematic racism, because I think I know what it is, but I haven't experienced it through their eyes.
I'd like to add one more piece if I can, if that's okay. We also believe that healthcare isn't just about blood pressure and numbers on a scale. Like health is so much more broad than that. So just thinking of all this, the social determinants of health that are at play. We have a wraparound set of services, and we also believe in strong connections in our community. So we have social work, we have behavioral health. We're working to get a medical legal partnership here at our health center. But we do believe that it's more about connecting and coordinating with the larger community to increase the overall health of our community.
Thank you, Levi?
Yeah, I would echo some of the comments that were already made, and then say from the perspective of Western Montana Mental Health Center, being a community behavioral health provider that typically deals with high acuity needs and seriously disabling mental illness, our agency is well accustomed to representing and advocating for marginalized or underrepresented populations. And I feel like the issue of racial injustice and social injustice really is something that we as an agency can have more prominent in our conversation. Even though we're very accustomed to advocating, I think we can expand that conversation to include some other underrepresented groups.
Thank you, Levi. And I know that as well for Project Tomorrow, we've been looking at the idea of health equity for a while now, and in particular, how even our statistics are gathered and reported. And we are lucky enough to have on our board several members from different organizations, and in particular, we've been working with All Nations Health Center to talk about health equity and how we are gathering and even reporting suicide in Montana, how those things have been gathered, but also how we're attacking the problem in new and creative ways. Our next question is from Sylvia Roma. I know that for addicts, group meetings are an integral part of recovery. I assume that many of these types of meetings have been moved to virtual meetings. However, I'm curious how you are reaching folks who are falling into substance abuse behaviors in light of the pandemic. Are virtual meetings effective for these folks where they didn't already have an in-person connection to the people with whom they were meeting?
So I would say from our perspective, we absolutely did the best we could with the technology to ensure that there was a constant connection. And we did use our telehealth platform to provide group meetings specific for substance use disorder, because that is such a critical component to those in recovery. But I think it would not be truthful if we didn't acknowledge that the face-to-face connection, in-person connection is also a significant component of that. So we've re-engaged some of those group therapeutic interactions in person to maintain social distancing with masks and appropriate precautions in place. But the substance, those in recovery from substance abuse do benefit from that in-person interaction more so than what we've seen in the telehealth setting.
And we do, they do have a full list of online virtual meetings with aa-montana.org, alanon-montana.org as well. And I do believe that even Narcotics Anonymous has an online platform to be able to access their online meetings, and all of those organizations have their 800 numbers and crisis numbers where you can connect personally to another peer support member.
I also think it's a challenge that we all transitioned to telehealth so quickly. I think if there wasn't a crisis, we would have all gone. I mean, telehealth was also in our I guess on our docket of things to expand with as well, but we would have done it a little differently, right? Like we wouldn't have done it overnight. And so I think we would have taken the time to triage which groups would be best to have in person, which groups would be best to have over telehealth. I know we're also not perfect in that either. And we have a lot of room to grow in that we did this overnight. And now we're thinking, okay, maybe certain groups, just like certain medical diagnoses or medical complaints are better in person. Maybe the same cases with behavioral health, with mental health too.
Thank you. All right. Looks like Ethel McDonald has asked, Rob, are there any plans to increase nursing and counseling staff with MCPS?
Yes, I would tell you that one of the things that we've had luck with is hiring health aides. We haven't had a whole lot of luck with finding nurses, quite frankly, because of the pay. Nurses generally can make more money outside in the public or in the private sector. So, but we do have quite a few nursing staff already. But again, what we're trying to lean towards or direct our resources are towards health aides, and health aides would provide those checks for kids during the school day for health screening checks. So that's one area. The counseling piece is a very interesting piece. We continue to look at that every year. It's become a statewide discussion. And so I would encourage folks to get involved in this at the legislative level. I will be involved in this in the next legislative session. But right now the state standards require one counselor for every 400 students. And we know that's not enough. But unfortunately, that's what we're budgeted for, and so we try to make that money stretch as much as possible. But this really becomes a state issue. The national standards on school counseling are one counselor for every 250 students, which I know also sounds like a lot. But if we can get closer to that ratio, then I believe we can obviously help more students. So that's something I know will be discussed at the Board of Public Ed and probably eventually at the legislature next legislative session. So as you see those discussions around school counseling, please get involved in those. We could use your help.
Thank you so much. There's a few questions around parents and how the parents in our community can support their children at this time, both with their learning and mental health, but especially parents who are working full time? How can parents find support as they have to figure out utilizing childcare or their own stresses as a parent?
I can speak to this. I bet we all have some ideas on parents and supports at this time. I think one of the biggest things to think about is when we have awareness for what is going on and how that could impact not only our kids but ourselves. That's kind of it's a really big piece. So I would say parents who are worried, parents who are concerned, the fact that you're concerned, the fact that you're worried, the fact that you're aware is huge. We actually look at awareness as a strong mediator in terms of outcome and child progress and treatment. Another piece to think about is structure. Yes, things are different. How can we still have some structure embedded in a routine throughout the day or parts of a routine? Another piece to think about is make it count where you can. So it might look different. Your time together may be different. But when you have that ability to have even 5 minutes of one-on-one time with your little one, your teenager, make it count for what it is. Join them in what they're doing. Get involved with what they might be excited about or interested about. We can use all of those opportunities as ways to increase just not only our relationship, but also their independence, and make sure kids and teenagers know how well they're doing managing all the stuff that's getting thrown at them right now.
Thank you, Dr. Potts. I know my entire family is playing Pokemon Go. I know more about Pokemon Go than I ever could have imagined. And Naruto and Avatar: The Last Airbender. So if you have any questions, call me. House full.
We also have a lot of resources on our Partnership Health Center website too. So that's partnershiphealthcenter.com.
We have just 2 more quick questions that I think we can get through. And I know we can't get through everything today or solve all the world's problems, but I think we're making a good beginning. A couple of the questions had to do with Rob. They wanted to know a little bit more about remote learning for those who can't attend or have significantly documented issue, or students who are choosing not to attend. And I know we don't have all the answers about this either, but what do attendance requirements look like under COVID?
Yeah, we're really hoping for flexibility from the state regarding our instructional minutes. We got that flexibility during remote learning, and we expect we will get that this fall as well from the state of Montana. So as you're probably aware, I mean, our funding is tied to our instructional minutes and the number of kids that are enrolled in our district. But we also know that kids learn differently at different rates. So we asked for, and we were allowed to look at that differently during remote learning, and we're hoping to do the same this fall. We will offer a remote learning option for any kids that can't come back. It will likely be very similar to the remote learning that we provided this last spring. However, we've obviously made some tweaks and gotten better at it, but there will be teachers facilitating that remote learning, but it may not be their regular classroom teacher. We also suspect that we'll have some classroom teachers that can't go back to work full time. And so we're hoping to pair those teachers up with students that are on remote learning. So the content will be provided, and then the teacher will be there to facilitate the students in their path towards achieving the content. So we'll have that option for families. I hope that families understand that. We don't want families to think that they won't have any options in the fall, but we'll allow for those kids that want to continue in remote learning to do so. What's been very clear to me, and I just want to be clear with our community as well, I can't ask a classroom teacher to do both. It's very difficult to do classroom teaching and remote teaching at the exact same time. So what we're trying to do is utilize our resources, the limited resources we have, and utilize those classroom teachers who can't come back to work as our remote learning teachers.
Thank you, Ram. And we have one more question really quickly. Can we, Carol Roberts writes, can we get a one-word answer from each organization on which technology platform you are using for confidential groups? Is it Zoom or Doxy, etc.?
Our district uses Google Meets.
We're currently using Zoom, and we're also exploring different options within our EMR.
I would say we're using Zoom, but I do want to clarify that there's a difference between the publicly available Zoom and the Zoom healthcare platform, which is dually encrypted.
And that's what we use too.
Thank you, Sarah. As we wrap up, is there anything you want to say, given what we're living through at this moment? Is there one last idea that you want to part with today, let everybody have as we settle in for the end? We'll start with Levi. How about that?
Yeah, thank you. So I guess parting thought for me, especially as it relates to mental health and behavioral health, and understanding what we think is going to be an increased need for those services. I would just urge compassion, I guess. I think understanding that everyone in this time is experiencing different challenges that they've never faced before, whether it's professionally or personally, family related. I think the best thing that we can do for each other and for our community is really to be compassionate about what everyone else is experiencing, and then also cut ourselves some slack. You know, we're also experiencing all of these things individually. So I think it's appropriate to just say increase compassion towards everyone, including yourself.
Sarah?
I'm going to pull a quote from the last part of our telehealth survey that I didn't really talk about, but we had surprisingly good outcomes and reports from patients who are accessing our telehealth services. There was one quote that really stuck out to me, and it is, "I'm thankful telehealth is an option, but to be honest, I'm experiencing a lot of online meeting fatigue right now." And I appreciated this comment. All of us are on this meeting right now. I know we're online, we're very attentive, we're all having our screens on, but it is a different way of working. And we're in a new time, and none of us have done it before. We don't even have data on how much this Zoom interaction or video interaction, you know, how our bodies experience it over time. So I think just being mindful of where you're at, maybe even if there's like a dose of screen that you might be feeling kind of over, step away from your computer when you can, step away from your work when you can. Practice that, model that for your staff, model that for your families, and don't be afraid to not take on more when you do have options. So I guess similar to what Levi said too, practice some good boundaries, practice some awareness of yourself. And I always speak to quality over quantity. So I may be able to spend 30 minutes taking care of myself in some way. Maybe I practice yoga, maybe I go for a hike. It matters that it happens. It doesn't matter as much how long maybe I spend doing those exercises, but it's that I take care of myself.
Great, thank you. All right, Rob, you got 30 seconds.
I won't even take that long. Remember what I said, flexibility and adaptability. I think those are really key, and maintaining a positive attitude.
Thank you guys so much for allowing me to be here and be of service with you today. Susan, I pass it back to you.
Thanks, everybody. Thank you, Rosie. Thank you, panelists and audience. I do want to say that I encourage people to not be anonymous, and somebody commented that he or she was choosing to remain anonymous due to his or her professional affiliation, and I totally get that. In my day job as CEO of United Way, sometimes Susan's position on an issue are mistaken for United Way's position on an issue, and United Way, of course, is Switzerland on many issues. So I would only say that in this Zoom format, we do try to stick as closely as possible to our regular format where, you know, we come together in person and we build bridges and engage in civil discourse. So I apologize to that person. I don't think you're a coward. I was just trying to stick with our regular format, but I definitely get it. This was really eye-opening for me in a lot of ways, and I think you all revealed in a very eloquent way that showed us how lucky we are to have each of you in your leadership roles, the opportunities and challenges that COVID-19 has brought. I do like to focus on the opportunity side, and I hope that all of our attendees paid attention to those opportunities for policy advocacy and systems change that we heard about the need for today, the kind that moves a community forward from, you know, charity and emergency response to a system that promotes equity and justice. And I think that's what we're all looking for. So thank you all for your great questions and our panelists for their great presentations. Again, thank you to our sponsors, especially our executive level sponsors, Blackfoot, and First Security Bank. Please join us on August 10 for a forum. Topic to be announced. Our forum committee is meeting this week. We have some great timely topics to choose from, but that forum is scheduled for Monday, August 10, and we hope to see you there. Format to be determined, I guess, but we really appreciate your active engagement, and everybody have a great rest of the week. Thanks a lot.